Again, not causing cancer, but can just be very painful for a lot of women.
There goes the Dove chocolate.
Yeah, but if you don't have fibrocystic changes in the breast, it's okay to eat. It's fine.
I just don't know how I ever got started on, because it's just great.
Yeah.
It's really, really great. Do you know what I heard the other day on TV? It was probably like 2 or 3 weeks ago. A 10-year-old girl was diagnosed with breast cancer.
Oh, wow.
Can you believe that? I'm glad I didn't forget this going to ask you. 10 years.
Wow, I hadn't heard that story. But
and she had to have a mastectomy.
Wow.
And you only get the little bits and pieces. You don't get to know what happened to the child or how or where she was.
Well, you know, I just think that our population is a sicker population. I think we're exposed to so many more chemicals and toxins. And, you know, my great-grandmother lived to be 102, and she was very healthy.
Yeah, and probably never went to a doctor, did she?
Yeah, and, you know, but she was eating, you know, she cooked every day. She had a garden. You know, we're eating a lot of these processed foods, and our kids are eating certainly a lot more. And so I think that's causing us to be a sicker population. So I think we've got to, you know, get back to basics.
And do what? May have our own gardens like Michelle Obama?
Well, if you can, but if not, trying to at least eat fresh food, trying to eat less processed food, less canned food.
What about water?
I think water's a good thing,
I'm a
but
firm believer in water.
Yes.
And also, I like a glass of red wine occasionally.
Red wine is good for the heart?
No, not anymore. Not on TV.
Oh, no!
They come out, consume 1 to 2 glasses of red wine every day. It's great for your heart and to prevent cancer.
Right.
Then not more than a week or 2 later, oh, we got to take back a disclaimer
Oh,
here.
my goodness.
We've learned that red wine can cause cancer. And I go, oh, my God.
Well, I think everything in moderation. You know,
yes,
I just
that's
think
true.
everything in moderation.
Yeah. But, you know, no matter what you do, it seems like there's always a risk.
Exactly.
So I guess you should just live your own damn life.
Exactly. I think you
just
live the best life you can.
The best life that you can, and try not to let all this stuff weigh you.
Yeah, because it gets to be confusing, even for us in the medical community.
Because I go to a gym, I go to Gold's Gym, and there's a gentleman who comes in there 93 years old.
Oh, good for him.
And he has osteo, and he's really bent over. I hope he doesn't watch the show. But we talk, and he still has all of his, what do you call it? He's not mind loss. I call it mind loss because, you know, he's not mind loss like that. He knows everything. He'll talk about his family back 50, 60 years ago. You know, never went to a doctor.
Wow.
He makes sure he has a drink of alcohol every day.
Oh, good for him.
So, I mean, there are certain things that we can do, like you said, in moderation.
Right.
We don't have to slug down a whole bottle of booze.
Definitely. Definitely.
And a 5-pound bag of Dove.
Yes.
But the most important is to go once a year for the mammogram.
Yes.
Also the breast exams.
Yeah, it's important that women do their own breast exam at home once a month.
In the shower or out of the shower?
You know, I don't think it matters as long as you're checking. If you're in the shower, you're already there, you're naked, you're soapy, just raise the arm up and check the breasts. You can do it before you go to bed when you're laying down. That's when the breasts are going to be the most flat. But you want to do it if you're a woman that's menstruating about 7 to 10 days after the start of your period. That's when the breasts are going to be the least lumpy. And if you're not menstruating for whatever reason, then I say just pick a day. Your birthday's on the 15th. Choose the 15th every month and make that your day to check your breasts.
She says
yes, Buddy Check 9.
Buddy Check 9.
Yes,
I love
yes,
her.
She's awesome.
She's become a good friend. I will call her up when she does a show, and I get it. She sends the people over
yes,
here.
Yes.
Have you ever met Andrea?
I have. I've been on her show a few times as well.
I love her.
Yes.
We've done health shows for children together and things like that.
Yes.
She doesn't act like a reporter. She's a mom. She's a woman.
Yeah.
But I'm glad you got to meet, her. She's a good lady.
I think she's doing a great job with the Buddy Check 9 and so
she does it with her mom or her sister now. I'm not sure what she said.
I think with her mom, I believe.
Yeah, her buddy.
Yeah.
Every woman should have a buddy.
Definitely.
To do that with.
And I always tell women, if go with a friend when you have a mammogram. If you're going to get evaluated for breast tissue, bring a friend with you. It always helps to just have someone there, an extra pair of ears. Yes, to hold your hand. Yes.
You have another question. How many different types of breast cancer are there?
There are 3 main types. When we look at it, we look at invasive and non-invasive. So the non-invasive are things like DCIS or LCIS, or terms people have heard, ductal carcinoma in situ. Those are the very early breast cancers, very treatable. Invasive breast cancers mean that the cancer, if we consider the cancer in a little ball and it's starting to kind of creep outside of the ball, and starting to invade the tissues around it. Not necessarily. You can have a stage 1 that's invasive. Again, very treatable. It just means that it's starting to spread out from where it used to be. And then there's inflammatory. And inflammatory is a difficult diagnosis to make because it doesn't show up as a mass. It usually shows up as one breast will be enlarged. It may be hot or inflamed. It may be a little red. It's going to look different than the other side. A woman will go into her primary care physician who will put her on antibiotics. And after a few courses of antibiotics, they'll finally say, hey, this isn't right, and send them for a mammogram. Nothing will show up on the mammogram. So the only way to make the diagnosis is to do an actual biopsy.
My goodness.
So it's a very hard diagnosis to make. And so what
It's
I
called
tell
inflammatory?
Inflammatory breast cancer.
Oh my
And
goodness.
so what I tell women is, you know, check your breasts, look, if something doesn't look right, if you weren't born with it, then it's not normal, then you need to get it checked out.
Right. Now also you have down here, what is the best treatment? Chemotherapy or radiation?
It depends on the type of breast cancer. There's some women who will get chemotherapy only, and there are some women who will get radiation only, and there are some women who will need both as well as surgery. So it really depends on the type of cancer. I think the important thing to realize is that breast cancer treatment is a multidisciplinary treatment. There are going to be a lot of different doctors. There'll be your surgeon. There'll be the medical oncologist.
That would be you. You're the surgeon.
I'm the surgeon, yes. But it should be a team approach. And so we consult each other. We sit and discuss the different patients in a group setting and discuss what's going to be the best course of action.
So you really do sit in a group and everybody
We
talk?
actually do.
Yeah, that's
we do.
good.
We communicate with each other, which is so important.
But you do the surgeries yourself?
I do.
What do you usually recommend, though? Radiation?
Again, it depends on the cancer. I will say that there are some newer forms of radiation. So there are some women, traditional radiation, a woman's going to get radiated to the entire breast for about 6 to 8 weeks. There's a newer form of radiation where if a woman gets a lumpectomy, meaning we can just take the tumor out, she's going to get radiation with a catheter placed in that cavity that we've created from taking the cancer out. She'll get her treatment done in 5 days.
Oh.
Which is a big difference. You go from 6 weeks to 5 days.
Is there hair loss with the radiation as well as with the chemo?
Not with radiation.
Okay.
Women mostly will feel fatigue. They may get a little bit of burning, similar to getting a sunburn on the skin. The hair loss is mostly with the chemotherapy.
And their chance of recovery is just as well as with the chemotherapy?
It is, yes.
I see. Well, this has been very rewarding. Can you believe our 30 minutes is gone?
No, I can't believe it.
I have had so much, I'm not going to say fun, I've learned a lot from you.
Great, thank
a
you.
lot of things. So I'm thinking I just might be changing doctors and be coming to see you.
Oh.
Because you're a woman and you understand.
Yes.
And I hate to, go to somebody who's not really interested in what's wrong with me.
Right.
I want to thank you,
Oh,
Dr. Hampton,
thank
for
you.
being here. And she has a baby, everybody, a 3-month-old son, right?
Yes.
So you're a wonderful lady. You're a beautiful lady. And I'm so glad you're here with us today.
Thank you so much for having me.
I want to thank you all for watching. Until next time. This was good.
Oh.